What do employers need to know about OSHA's Emergency Temporary Standard covering workplace vaccinations?
The Federal Occupational Safety and Health Administration, or OSHA's Emergency Temporary Standard, issued in November 2021, requires all employers with at least 100 employees to ensure their workers are fully vaccinated against COVID-19 or submit to weekly COVID-19 testing. The standard, or ETS, initially was stayed by a federal appellate court following multiple legal challenges. In late December, the stay was lifted and trade groups petitioned to the U.S. Supreme Court to block the ETS. The Supreme Court heard oral arguments on the ETS lawsuits on January 7th. Despite the ongoing legal challenges, employers subject to the OSHA ETS should prepare for compliance. The ETS provides covered employers with two pathways for compliance. Number one, requiring that all employees be vaccinated unless the employee qualifies for a medical or religious exemption, or number two, provide employees with the choice of either showing proof of vaccination status or participating in at least once weekly testing. The ETS covers employers with 100 or more employees company-wide. There are certain caveats and exceptions when calculating the 100 employees, including healthcare employers that participate in Medicare and Medicaid programs. Here are brief summaries of 8 major points of the ETS for employers to understand. 1. All covered employers must implement a mandatory vaccination policy. The policy can either be a hard mandate or a soft mandate. A hard mandate requires vaccination of all employees, including new employees, and it must also include a process for accommodating employees that cannot get the vaccination due to medical or religious reasons. A soft mandate allows for a vaccination or test option. 2. As of February 9th, any employee who is not fully vaccinated, either due to an exemption or because of a soft mandate, and who reports to a workplace must submit to a COVID-19 weekly testing protocol. The employee must take and provide proof of a negative test at least once every 7 days. 3. Employers are required to remove immediately from the workplace any employees who test positive for COVID-19. And before coming back to work, employees must meet certain specific return to work criteria. 4. Covered employers must ensure all unvaccinated employees wear a face covering while indoors or when in a vehicle with another person for work purposes, with limited exceptions. If an employee cannot wear a face covering because of a disability or a sincerely held religious belief, the employee may be entitled to a reasonable accommodation. Employers have to evaluate face covering reasonable accommodations to ensure they provide conditions equally as safe as those provided by wearing standard face coverings. 5. Starting January 10th, the ETS requires covered employers, regardless of whether they implement a mandatory vaccine policy or the alternative testing approach, to provide up to 4 hours of paid time to receive each dose of the vaccine, and reasonable paid time for sick leave for side effects. 6. Employers must report COVID-19 work-related fatalities within 8 hours of learning of the death, or within 24 hours of learning of an employee's inpatient hospitalization. 7. If you have operations in one of the 22 OSHA state agency jurisdictions, you may have more stringent requirements that you need to follow. 8. Even if an employer is compliant with the ETS, it does not eliminate the other requirements an employer may need to follow due to potential exposures in their workplace, like health screening, close contact investigations, or physical distancing. Employers can still be cited for other violations due to COVID-19 exposure under the General Duty Clause. Each of these points in the ETS include many additional details and related requirements. Employers facing the difficult task of deciding how to comply with the broad mandate regarding testing, vaccines, and return to work are encouraged to discuss their options with employment counsel.